Hello everyone. Let's start on the topic of assessment of the hearing loss, which can be done through clinical test, audiometric test, and there are some special tests of the hearing. Under the clinical test, finger fixation test, voice test, speech test, and tuning fork test. These three tests are not performed these days in the clinical practice as compared to tuning fork test, under which comes six tests: Rinne test, Weber test, absolute bone conduction test, Swabak test, Gales test, and Ping test. We will be dealing with Rinne's test. Before understanding the Rinne's test, it is important to understand these three things. What is the normal pathway of the sound conduction? What is the role of the middle ear in the sound conduction? And what is ear conduction and bony conduction? After this, it will be easy for us to understand the Rinne's test. Let's focus on this. Normal pathway of the sound conduction. So we all know that the sound is conducted from external ear to middle ear to inner ear. That much? No. The conduction pathway of the sound is not only just the external ear, middle ear, and the internal ear. We all know that the information must pass to the brain to interpret it. So there must be some connection between the inner ear up to the cerebral cortex. Let's crack this. Suppose the sound is being produced in the air. First it will reach to ear pinna, then to the external auditory canal, then to the tympanic membrane. So this up to this tympanic membrane, it is external ear. Then the sound goes to the middle ear, alias incus, steps, footplate of the steps. So this is middle ear. Then it goes to the inner ear. In the cochlea, where there is the organ of Cotai, which will receive the sound. After the cochlea, it must reach to the cerebral cortex, for which there must be some neuronal connection. Up to the footplate of the steps, we are clear. The sound reaches the organ of Cotai, which is in inner ear. Now the information is passed from the organ of Cotai to the eighth nerve, then to the cochlear nuclei, then to the olivary nuclei, lateral lemniscus, inferior colliculi, medial geniculate body, and finally to the auditory cortex, which is the area 41-42. Which can be remembered by a simple formula E. coli Ma. And this whole pathway is called as the auditory pathway. This is all about the normal pathway of sound conduction. The sound is being conducted from the external ear to the middle ear to the inner ear. No any involvement of sensory organs or the nerves in this pathway from external ear to the middle ear. The sound is just being conducted. So this is called as the conductive pathway, and if any defect occurs in this, it is called as conductive hearing loss, either in external ear or in middle ear. In inner ear, we have organ of Cotai, which is actual the sensory organ. So the pathway is called as sensory pathway. Any defect will lead to sensory hearing loss. Now, this is the auditory pathway, auditory cortex, which involves neurons. So the pathway is called as neural pathway. If any defect, neural hearing loss. Sensory hearing loss and neural hearing loss together are called sensory neural hearing loss. There is involvement of eighth nerve, it is called as retrocochlear hearing loss. If rest any is involved, it is called as central deafness, because these all are the part of the central nervous system. This eighth nerve is the part of the peripheral nervous system. So now we have finished with normal pathway of the sound conduction. Let's go to role of middle ear in the sound conduction. So middle ear helps in both amplification of the sound as well as the dampening of the sound. In our day-to-day activities, we come across both very low frequency sounds and very high frequency sounds. And it is very much essential to dampen the high frequency sound because it may damage our inner ear, which is done by stapedial reflex. Similarly, we want to hear as much as low frequency sound which we can hear. For that, amplification of the sound is essential. The sound is being produced in the air medium and it travels through the external ear to the middle ear to the inner ear. In the inner ear, there is liquid medium. So the sound has to travel from the air to the liquid. That is, the resistance is being increased. So to match that resistance, that is to match the impedance, is very much essential to amplify the sound, which is done by the ossicular chain involving malleus, incus, and steps. And this oscicular chain amplify the sound due to these two mechanisms. One is the aerial or hydraulic ratio and another is the lever ratio. This aerial ratio is the effective vibratory surface area of tympanic membrane by the steps foot plate area. These are the value. It comes to be 17. Similarly, the lever ratio. The handle of the malleus is 1.3 times longer than the longer process of the incus. When we multiply the 17 with 1.3, it comes to be 22. So basically the middle ear amplify the sound by 22 times. But we have to understand that total surface area of the tympanic membrane is different from the effective vibratory surface area of the tympanic membrane. The sound reaches to the tympanic membrane. Not all the part of the tympanic membrane vibrates, only some parts of the tympanic membrane vibrate, which is known as the effective vibratory surface area. It's 55 square mm, while the total surface area of the tympanic membrane is around 85 to 90 square mm. The main role of the middle ear is to amplify the sound. So one thing we understand from the middle ear is that whenever in any of the pathway, if there is the involvement of the middle ear, then there will be the amplification of the sound. That is, the sound will be heard more louder and for the longer duration. So now we have also finished the role of the middle ear in the sound transmission. The next one is air conduction and the bony conduction. Before understanding about the air conduction and the bony conduction, let's study about the part of the tuning fork. These two are called as the prongs. This is the stem and this is the base of the tuning fork. So what is air conduction and what is bony conduction? The name itself suggests in the air conduction there is the involvement of air, while in the bony conduction the conduction is through the bone. There is no involvement of air. So suppose tuning fork is vibrated and placed in the air medium near to our ear, then the sound will travel through the ear. This is the air conduction pathway. But if we place the vibrating tuning fork directly on the bone, then it will follow the bony conduction pathway. So these two are different pathway. So air conduction pathway involves this whole external ear, middle ear, inner ear, as well as up to cortex. It means to say that this whole pathway, external ear, middle ear, inner ear and auditory pathway, is involved in the air conduction pathway. So in air conduction, both conductive pathway as well as the sensory neural pathway are involved. But what about the bony conduction? In bony conduction, we put the vibrating tuning fork on the mastoid process. This is the mastoid process. So vibrating tuning fork will also vibrate this mastoid process. And now the whole skull will vibrate. This leads to the vibration of this petrous part of the temporal bone as well. And in this petrous part of the temporal bone, there is the cochlea. And when the cochlea vibrates, this will vibrate the cochlear fluid. And vibration of the cochlear fluid will also vibrate the basilar membrane, which will be perceived by organ of Cotai. Then the same pathway will be followed. So in the bony conduction, this whole conductive pathway has been escaped because the sound is not being transmitted through this channel. The sound is transmitted through the bony pathway. So in the bony conduction, only the sensory neural pathway is involved. The same thing is written here in air conduction, conductive pathway plus sensory neural pathway. In bony conduction, we have only the sensory neural pathway, no conductive pathway. No conductive pathway means no involvement of the middle ear. And if the middle ear is not involved, the sound is not amplified in the bony conduction. So we can conclude that in healthy ear, air conduction is greater than the bony conduction because of the involvement of the middle ear, which amplify the sound. So this way we have finished air conduction and bony conduction. And so now it is the turn to understand the Rinne's test. So, the Rinne test is basically performed to compare between the Bony conduction and the air conduction. And in this test, we use the tuning fork of frequency 512 Hz. If we use greater than 512 Hz frequency, then the sense of bony vibration is felt by the patient, which make them irritated. If we use greater than 512 Hz frequency tuning fork, it will decay quickly, which we don't want. In Rinne's test, what we do is first make the patient comfortably sit, greet the patient, take the consent, and explain whole procedure, and then ask the patient to raise his hand when he stops hearing the sound. After this all, we vibrate the tuning fork on our elbow and put the base of the tuning fork on the mastoid process. As soon as the patient stops hearing the sound, he will raise his hand. Immediately, we put the prongs of the tuning fork at about 2 cm distance from the external ear. He will still hear the sound for some moment, because we know that air conduction is longer and louder than the bony conduction, until and unless there is any defect. So in Rinne's test, two conditions can arise. One, air conduction greater than bony conduction, and another is bony conduction greater than an air conduction. Normally air conduction is greater than bony conduction. Okay, fine. But even if there is sensory neural hearing loss, then also Rinne's test can be positive. But how? Suppose a patient has sensory neural hearing loss, but it is not so severe that this pathway is completely blocked. It is working but not perfectly working. So for bony conduction, this pathway will cause little obstruction. For the air conduction also, this pathway will cause little obstruction. But yes, the sound is being amplified in the middle ear for the air conduction. So still air conduction is more than the bony conduction in the sensory neural hearing loss. But what if there is severe sensory neural hearing loss? Suppose it is so severe that the whole pathway has been blocked. So for the air conduction, the pathway from external ear to inner ear is all okay, no problem. But sound cannot travel up to auditory cortex because this pathway is gone. So the patient will not hear any sound. Air conduction will be zero. But what about the bony conduction? Yes, this pathway has been gone, so the bony conduction will not occur. Though through this ear, bony conduction do not occur, but we have already discussed that in the bony conduction, this whole skull vibrates. So not only this ear, but the contralateral ear also perceive the sound. So the patient will still hear the sound in the bony conduction, but from the contralateral ear. So in this severe sensory neural hearing loss, air conduction 0, but there is some bony conduction. So bony conduction will be greater than the air conduction. But opposite to this, in the sensory neural hearing loss, air conduction is greater than bony conduction. I hope everything is clear. So from the Rinne's test, we come to know that in normal ear, air conduction is greater than bony conduction. Similarly, in the sensory neural hearing loss, when it is not so severe, still air conduction greater than the bony conduction. In case of severe sensory neural hearing loss caused by viral infections, bony conduction is greater than the air conduction. Now for the conductive hearing loss. In conductive hearing loss, there is defect in the conductive pathway, either in external ear or in the middle ear. If there is defect in this conductive pathway, then the air conduction cannot occur because this pathway is blocked. But the bony conduction can occur. So in this conductive hearing loss as well, bony conduction is greater than the air conduction. The thing which we need to understand in the Rinne's test is Rinne's test will be positive if air conduction is greater than bony conduction. It will be negative if bony conduction is greater than air conduction. Rinne test is positive, indicating either the ear is normal or there might be sensory neural hearing loss. If it is negative, it means to say that either there is conductive hearing loss or there is severe sensory neural hearing loss. So now it is essential to distinguish between conductive hearing loss and this sensory neural hearing loss. And this is done by Weber test, which we will be discussing in next video.